Well, it's been a long time since we've talked, Raghad. It's really kind of you to come back on the channel.
Yes. Yes, thank you, John. It's very nice. I told you Corona has some advantages. We have new friends like you and like others. Really, I appreciate your work. You're doing really great job. You are helping a lot of people all around the world. Uh, I hope others would do like you do, especially those who are specialists in
Yeah.
this field at
Uh,
this dark time.
Absolutely. Let's hope this is a way for people around the world to come together. I couldn't agree more, Raghad. It's absolutely
Yes,
fundamental. Now, for those
yes.
who can't remember, Raghad is a professor at Baghdad, in Baghdad in Iraq. She's a virologist and an immunologist, so she's in an ideal position to talk to us. So, Raghad, I am aware that the cases in Iraq now are the highest they've ever been.
Yeah, yes. In
To
fact,
tell us about the situation, please.
yes. In fact, the numbers is are increasing sharply. If we compare between 2 months ago and the situation now, before 2 months we had between 4,000 to 5,000 that are which are recorded, but now we reach more than 13,000 daily. Of course, the true number is much higher, and it depends on the number of the tested samples. If we take the percentage, which is more accurate, before we had from 8 to 10% positive samples from all tested samples. Now we are reaching more than 25% or 27%. The situation in Iraq, I see, is really very difficult, and it's very hard. The problem may be divided for many reasons or related to many reasons. First of all, people don't follow the precautions. Vaccination started in Iraq since March, and it started very slowly, but it increased nowadays when the people saw there are too much deaths we have, and too much are infected. This causes too much crowding at the medical centers for vaccination. I didn't I didn't like the organization there. It is very important to follow the social distance, even at the vaccination centers. It should be more organized. Otherwise, this would create itself a problem. Number of vaccinations of vaccinated people is less than 2 million. Our total population is more than 40 million. And the 2 million, we don't know if it is if they took the both vaccinated doses or just one. It is not announced. I don't know how many had the two vaccinated dose. The Ministry of Health should explain. But I think most of them just took one dose because just in the last 2 weeks, number of vaccinated people increased when the number of infected persons increased at the same time. Now we have about, let's say, more than 100 persons in the ICU unit. Unfortunately, one of them is a newborn baby. She's 12 days old. This is really a tragedy. Let's say about the number of deaths, the total number since last year so far, it is more than 18,000. And I believe the number of deaths is more. Many people are dying at their home and they don't inform others. The problem here is related how this is organized or how this is managed. At the same time, people still don't know how dangerous is this virus. Still, they say, wow, it is like a flu. I had infected and I'm fine, okay. There is a very shortage in information about COVID symptoms after recovery, which we know the long haulers, which is more dangerous maybe. Uh, at the same time, every day we have about between 40 to 80 dying people. Number of deaths daily number is increasing. Unfortunately, we are losing a lot of our friends, and this is very sad. This is the whole situation how I look at. At the same time, I think we need lockdown really, because without lockdown, this will mean nothing. But the situation here is very difficult because everything is interact with everything, you know, politics with economy, with health, with corruption, these mixed are together. At the same time, people need work. Okay, work, but follow the instruction. Wear a mask. Here, it is very rare to see people wearing a masks. Maybe, let's say, less than 10% of the total population wearing a mask. Gathering is still continuing. Uh, Restaurants, cafes, malls, all are open. And it was strange to hear yesterday they just closed the swimming pools. It's not a problem in the swimming pool. All gathering should stop now. We need really a lockdown or even partial lockdown. But this is the situation, unfortunately. I think the number would increase more and more and we'll be in a very terrible situation. The last 2 weeks caused a result in increase or sharp increasing in the numbers, maybe because we had the Eid al-Adha. Most of the people here went to Kurdistan area. It is places in the north where temperature there is a bit lower. You know, the weather is very hot here. Temperature is over 45. Sometimes it reach 50. So this gathering in the north, and this was the main reason to increase the number of infected people in the north, and they came back to Baghdad and so on. I don't know what to say, really. I feel angry and I feel sad because of this situation. Unfortunately, even some professors, some educated people are against vaccination and they don't follow the instructions. However, let's say there is a light, others are following, and this is it. For our work in the university, now we have the exams. Some of the courses is online exam, others it should be in the university itself. And you know, even the students they don't follow 100% of these precautions, and we just keep all the time wear a mask, and this is the situation, John. So I don't expect it will be better soon.
Yeah, I can hear your frustration, Raghad. I mean, it's just painful for someone like you who's so well informed and can see the problems, and that you see all this relative chaos going on round about you. But both from administration who should be organising things, and from the lack of public compliance, where the lack of public health education messages.
Yes, besides that all, we had really a disaster situation when 2 hospitals were burned, had a fire. One in Baghdad. In Baghdad, it was Ibn al-Khatib Hospital in the Baghdad, in the center of Baghdad. Too many people were dead. And that was first strategy. I think it was maybe in April, mid of April, something like that. The other one was in the south, in Nasriya. The hospital was made for emergency use. It is made of sandwich panel. It has no safety precautions at all. And you know, working is oxygen is really dangerous. Too much were dead. So at that time we were very sad, and we are still. Sometimes people worrying from going to hospital because of these events.
The actual physical risk of going to hospital,
yeah.
So a lot of deaths from 2 hospital fires in a short period of time. And the other thing that frustrates me so much about Iraq is when you think about the history that we're both painfully aware of over the last 20 years, and the foreign intervention and the lives that have been lost, and the massive amount of money that's being spent. And now with relatively small Western interventions, just maybe less than 1% of what was spent on military things, we could make such a massive difference to the country. And I just find it so, so frustrating at every level.
Very true. It is a matter related to corruption. Yes. At the same time, because of this history, we spent more than 50 years in war, John. People were used to die. Someone told me, why you are so worried about COVID? We were always dying for a reason and the one. This is just a new way of dying. We get used on losing our beloved. This is how the interaction inside the country. There's too much talking. And if we add to all that, there's a lot of misinformation, a lot of rumors. Some of them is very funny. Someone indicated, wow, you took a vaccine, you should not take a bath or shower. Imagine. Others are saying, wow, you took a vaccine, this will change your DNA. Others are indicating this will make you non-fertile. You will lose your fertility. Others, one of the stupid rumors I have faced just before 2 days ago, if you take a vaccine, you should not go to any doctor to make any surgery because anesthesia will kill you, and this is not correct. I don't know, wow, from where they bring these rumors.
Where is this coming from?
I don't know. This is really very strange. Yeah. I think about the human, why they believe in these rumors and they don't believe to science. How come? This is something related to psychology of a human. I have this question. Why this happen in all the world? Why people believe in the rumors and they doubt about science? This is not correct.
And I know you're doing a lot to publicize science in Iraq. You have social media and things, and you're.
I'm trying.
I mean, I read it, and everything you put on there is good. Well, your virology and immunology is way better than mine, but you know, everything you put on there, I completely agree with. You know, it's proper.
Thank you. Do you translate, John? Because I see your like there.
I sometimes use Google Translate, Raghad.
I see. This is what I thought.
Yeah, my Arabic actually isn't that good, I'm afraid.
It's okay, no problem.
Unlike your English, which is quite excellent. What variant are we worried about in Iraq at the moment?
I'm really worried about Delta variant. In the north, there was an announcement from their health sector there. They had Delta variant, and Delta variant is increasing in the north. And at the same time, this rapid increase and change, let's say a big change in the symptoms and rapid death and rapid all these comorbidities, this indicates, I'm sure we had a Delta variant. This makes me more worried. I'm afraid of we will have an Iraqi variant, a new Iraqi variant, because you see gathering everywhere. This is crazy. Gathering without wearing masks.
I mean, you're Professor of Immunology and Virology there. Are you able to do any genomic sequencing in Iraq?
At the beginning of the pandemic, we don't have these instruments for DNA sequencing, but I hear they bring what they need for sequencing, but I doubt really. But they can do it anyway outside, maybe in the north. In the south, I mean, they have some possibilities. The problem here, there wasn't much attention for science, for education. I told you from beginning, everything interacts with everything. This is all related together. This is it. It's a matter related to leaderships. And you know, we have too much corruption in this country, and this is known for all the world.
Is the corruption at every level, Raghad? Is there like corruption at senior levels and junior levels?
It is in every level and in everything. You cannot believe the level of corruption here.
But it does concern me that, so basically you're telling me that Baghdad University does not have a genomic sequencing capacity?
No, we just have instruments for PCR and these things. It is difficult.
So we assume basically that there's Delta variant in Baghdad now. Is that the assumption?
This is what I think, but if we talk scientifically, it is not approved. I'm a scientist. I cannot say unless I see a data of Delta. But from this is my conclusion from all the situation, all of it. People are dying quickly, John. And just short time of symptoms and they are dying. This is, I think, these symptoms related to Delta. You know, there is a high load. The dosage of the virus is very high in Delta. It is different.
So, and as you say, there could be, for all we know, there could be a new Iraqi variant. We
Yes,
simply
yes,
don't know that. That's
yes. And
and,
this
and
makes,
this is a problem not just for Iraq, of course. It's a big problem for Iraq, but of course, any new variants that arise in parts of the world that don't
yes,
have sequencing, that could spread to other
of
places.
course, of course. In this situation, you may see it in most of the Middle East. Maybe Saudi Arabia is doing well. It is
Yeah.
controlling. Even Jordan is doing very well
Yeah.
for the controlling. They all follow the scientific precautions and instruments, and everything is very, science there is very high. Other countries are not. We need sequencing, and it is hard to make. What I think, the WHO must take a step to approve ivermectin, John. You and I, we followed, and maybe other scientists or specialists followed the research about the result of ivermectin, whether as a prophylaxis or a treatment. It has a very high advantage. I don't know why WHO stand against it, or it didn't stand. It just say make it for clinical trial, and this is not correct. Ivermectin is very cheap, and it is available. It is available here in Iraq. Some doctors are prescribing it to their patients. Others are not. I think WHO must take again a look for the results of ivermectin. If they disapprove it, they should say why scientifically. Give me a scientific reason for it.
Well, here we are. Raghad as a professor and me as an outside observer are officially calling on the WHO to give us the science to make this pronouncement. If it's saying ivermectin's rubbish, fine, but put that in writing. Everyone sign it. If it's saying it's good, then let's start using it. We need some definitive answers on this. The current situation is not acceptable.
Yes, it is, because ivermectin will save the lives of others. I'm not a physician. I cannot prescribe this drug to anyone. Sometimes I have some patients just talking with me. I say, okay, ask your doctor if it is okay to use this drug. When their doctors allow them to use it, they recover quickly. This is a very noticeable here. And I noticed here it is used maybe in some areas in UK, in USA, in Bureau, in Cairo. It is widely used, even in India. I think a number of infected persons decrease in India because of ivermectin. They are used as a prophylaxis, maybe in some areas. And even if you notice, you follow India, number of deaths is declining. So give me a good reason, scientific reason for that. We can't take advantage of it. We have to learn from experience of others. This time is everyone should learn from others.
Well, in India, it's certainly not vaccination, because it's still only 10% or less of the population is vaccinated in India.
Of course.
Yeah. So I mean, as a virologist, you know that ivermectin has antiviral properties. It works against RNA viruses in laboratory situations, and not to exploit that would just seem.
Yes.
Well,
it is antiviral.
It
has many advantages. Antiviral, anti-inflammatory also. It is approved. This is not my talking. This is what's written in many research. This is science saying.
So it's a bit pessimistic. Well, it'd be good if ivermectin was more widely used in Iraq, obviously. Do you know if the doctors there are collecting data on, when they use it, are they collecting data on the efficacy?
In fact, no. Most of the doctors our health ministry follow the protocols that's for WHO. Some doctors, let's say few of them, are prescribing this, and this is their how they think. This is related to them, but there is no data. So far, no data.
But of course, individual doctors and clinicians are not statisticians. They're not. They're not researchers. They're primarily clinicians who do a bit of research on the side. They're not professional researchers, which is part of the problem. So I'm really quite concerned here. We've got almost certainly Delta variant. We've got people getting sick and dying more quickly. So sometimes within days. We've got poor public compliance. We've got limited top-down organisation. the cases are now the highest they've ever been. So, I mean, I'm afraid it just seems inevitable to me that the cases are going to carry on increasing for some time in Iraq.
I'm sure this is the situation. The problem is how to talk to people, how to inform them. Some people think if they took a vaccine, they would get the immune response directly, which is not correct. Some of them taking vaccine without wearing a mask. There is still too much to do about this.
Yeah. One thing we could do, maybe you could do an Arabic warning, and I'll publicize that as widely as I can.
I used to write, on my Facebook, I have a hashtag, which is Corona is not a joke. This is my hashtag. And I used to write about this all the time. Thanks God, I have some followers.
Yeah.
And they follow, they listen. Sometimes they ask scientific question, I would reply. This is what I can do. I'm not in any responsible in the health sector. I'm just a professor. I'm teaching.
Yeah,
but I think this is my duty.
You're just a Professor Raghad, that's all.
Yeah, I have information. I like to others to listen to it. That's it. Just trying to helping my people. Really, I feel sad because there is a lot of misinformation. People must know it is not only infection. We may have other troubles after the infection.
The long COVID.
The long hauler, long COVID. This is another trouble. This is what's facing in USA, maybe in UK and other countries.
Yeah. Raghad, how's your health been personally over the past year? Have you stayed healthy?
Fine, thanks. I'm well. I took my vaccine early. I used to take vitamin D level. I check vitamin D every 6 months. I'm completely, let's say, isolated. I don't leave home only for when it is necessary. I go to university. When I go to university, I wear double masks, not one. And I trying to follow all the correct instructions. So far, thanks God, I'm fine.
Indeed. Well, what vaccine did you have, Raghad?
I had let's say at the beginning, I had Sinopharm in March. Then after 3 months, I checked my antibody level outside Iraq and I found it low. We all know the immune response is not a matter of antibody. We have cellular immune response. And that is okay, no problem. We have here in Iraq now 3 types of vaccination: Sinopharm and AstraZeneca and Pfizer. People all want Pfizer and they ask me which one is better than the other. It is not time to compare between one vaccine and another. I used to say there is a shortage in vaccine. Everyone should take what is available just to help himself, and we can get of this. Others are trying to choose and they insist, well, we want Pfizer, only Pfizer. Okay, if you want a Pfizer, you should wait when we have more supplies of Pfizer, but you should follow the instructions. Others are taking Sinopharm. Sometimes people even thinking about which vaccine is better, which vaccine has less symptoms, and I think this is not correct to compare between vaccine. We are between vaccines. This is not a good time. We should protect ourselves from everything which is in our hand now, not waiting for another time.
Indeed. Have you had 2 doses of the vaccine, Raghad?
Yes. I had my 2 doses earlier. And I put my photo on Facebook.
We'll have to show people that. And sorry, you did say you had 2-month gaps. You said, didn't you?
No, not 2 months gap. I had for Sinopharm 21 days gap between first dose and the other.
21 days, right. Because there seems to be some evidence emerging that a longer gap is going to give longer term immunity.
Yes, I read that. It is very correct for AstraZeneca. Some reports are saying now in Pfizer, if it's a longer gap, would be better.
Yeah.
I don't. As Sinopharm, the problem, there's not much information about it. But even I think all the vaccines will not protect from infection, but will protect from hospitalization, from
Yes.
dangerous situation, from
Yes.
death.
Indeed.
This is it.
Indeed. Yeah. Raghad, that's a very informative, if somewhat disconcerting report, I must say. But you mentioned the weather there, just out of interest. What temperature?
Yeah.
What temperature is it today?
You cannot imagine. You can cook outside. If you put a meat outside, it will be cooked. Temperature is over 45, John, in Baghdad. Maybe in the south it is higher. It would reach maybe sometimes 50, 52 centigrade. It is very hot, and this is why people gathering inside. This is another problem.
Yeah.
This is it. It's very hot nowadays.
I
Yeah.
mean, that's life-threatening temperatures outside, isn't it? I mean, you would die. You could die in that.
I think we will die from corona, not from the temperature. I believe in this. We get used from temperature.
Yeah. So you've got aircon inside. You've got air conditioning.
Yes, sure. Everywhere air conditioning, but we have a problem, of electricity.
Right.
Electricity cut all the time.
Yeah.
In every area there is a generator supply. I'm sure we pay for it monthly. But the electricity is very bad in all the Iraq. We are suffering from that since 2003 and before.
Right. So a lot of it's just local generation with local generators.
Yes.
Yeah.
Yes, this is it.
Yeah. It'd be such a great place to have massive solar panels, wouldn't it? I mean, there's so much sun.
But it is without benefits. It will not give us vitamin D, John.
No, that's true. But it will give you air conditioning, which is also good. And it'll keep your refrigerators running. Well, what about food and everything? I mean, did you go to the supermarket?
Yes, personally, I take all the precautions. I don't enter any supermarket which is crowded.
Yeah.
I just look from outside. If it's not crowded, I enter. If it's crowded, of course, I will not.
Yeah, but the supply of food's okay. You keep your food supply.
Yeah,
okay.
no problem. Food is available, no problem. But the problem, it's related to the economics, John.
Yes.
All this pandemic related to economics. We have problems in the education. Many students were taking their courses online, and this would affect the level of the education. And they decided to make the exams part of the courses in the universities, other courses online. Everything here is mixed. I told you, this interact with this and so on. Life is not very good, but if you walk outside in Baghdad, you think this is another planet. You don't feel there is a pandemic. People are just going and going outside, going everywhere. There is a celebration, parties, everything is normal. I become crazy from all that, John.
And they just accept that people get sick and die, and it doesn't seem to be there seems to be a disconnect.
I don't know how they think. Maybe they don't know about this, or they just ignore it. Maybe, at one point, I think this is psychologists. Sometimes once you are afraid from anything, you will ignore it and you behave in the opposite. If we analyze it from psychological point of view, this country was under pressure for more than 50 years ago, John. Under pressure, war, killing, dying, and this is it.
Oh, was that terrible war with Iran in the 80s? It was terrible. Went on for years.
In everything, even after 2003, even explosion does not ended so far. Even killing of the people, kidnapping is still going on. This is it. Psychology of the Iraqi people is different, I think.
So you hear bombs going off from time to time from where you are now?
Maybe let's say it's not very much, but it happens. It would happen. The problem, we may have an election in October, and this will have another problem for gathering.
Yeah. I mean, what's your personal security like, Raghad? Can you walk around Baghdad on your own? Is that a problem?
Yeah, no, not a problem at all. I used to walk. I like walking personally, but not in this very high temperature.
Not when it's 47 degrees centigrade. No.
No,
Yeah.
no. It is, let's say, much better security. We are safe, but it happens from time to time, in different areas, and it happens, and this it will close, and if life become normal, just the next day. That is it. We get used on it.
Yeah.
It's not a new situation.
But it's not the sort of thing you should be getting used to, is it? This should not
It
be the
should.
it should not be the
Yeah.
normal way of life.
It should be. Yeah.
Yeah. Raghad, that's a really good report. Thank you very much. God bless you. God bless Iraq. And would you like to would you like to give just a sort of, there'll be quite a few people watching who are Arabic speakers. So just if you're an English speaker now, you can switch off. But would you like to just put out a few key messages in Arabic that we can perhaps circulate around, Raghad? The key messages about the mixing, the infection, the vaccination, the risk from the Delta variant.
In Arabic, you like?
Yeah.
Okay, in Arabic, my hashtag was Corona is not a joke. In Arabic, Corona ليس مسحة. Be careful. كن حذر. Follow the instructions. اتبع القواعد الصحية أخي. كي لا يكون لدينا سلالة جديدة بالعراق. We don't want a new variant in Iraq. Keep on social distance. Keep on wearing the mask. Take the vaccine, any vaccine that is available. This time we should be very careful. خذ اللقاح المتوفر. هذا هو وقت الحذر. Thank you, John.
Thank you, Raghad. Really appreciate it. Thank you so much for coming back on, and God willing, we'll talk again.
Thank you.
When there's something to report in Iraq, which I think, unfortunately, might not be too long.
Thank you.
Yeah,
hello.
Thank you. It's great to talk to you, Raghad. I know a lot of people around the world have been looking forward to seeing you again.
Thank you.
Yeah,
thank you.
you.
Bye-bye.
Bye, Raghad.